8:23 and temperatures in the 20s right now. There's your live look at Fort Worth as we kick off our Saturday. So something that's not always fun is to talk about health and health screenings, but we are doing it anyway. We welcome back to Good Day Dr. James of Diamond Physicians. So we talked about men in their 20s, 30s, and 40s, left off with 50s. Let's talk about that particular age group. What specific screenings these guys should be getting?
There's a major milestone when you hit your 50s, and that is the colorectal screen. Colonoscopy starting at age 50 is very important. Colon cancer is on the rise in America, typically because we eat a lot of red meat and also other inflammatory foods. But the colorectal screen, that colonoscopy, every 10 years, once you hit 50, if it's normal, is what we recommend until the age of 75. Once you hit 75, talk about it with your physician, because we do a case-by-case basis if we should continue those screenings at that point.
And are you noticing your patients actually coming in every year for this?
Well, that one is every 10 years.
Oh, that one's every 10 years.
And they don't like it. So it's really hard, especially men, to get them to do your colonoscopy.
To even get them to do it every decade. Okay.
Exactly.
Now, 60s and beyond, let's talk about the vitamin D supplement. Is there a test for that, or what do they need to be looking at? We'll
do a vitamin D screen. You know, bone health is very important. 60s, 70s, and 80s, you're at higher risk for falls. We want to make sure that the vitamin D levels are high. And then also lung cancer screening. So if you have any smoking history, a 30-pack year history, or if you quit smoking within the last 15 years, we recommend a low-dose CT scan of the chest to look for lung cancer. And that's every year we recommend that if you have a significant smoking history.
So you're talking about smoking, but are there other tobacco uses that people need to be concerned about in terms of tests, or is it just
If you've used chewing tobacco, then we can do an oral screen, but specifically for the chest, it is smoking cigarettes or cigars.
Okay, cigarettes or cigars, and it's even if you quit 15 years ago.
Exactly.
So even if you quit in, say, your 40s,
we still want you to get screened.
Okay. Now, final recommendations for men every year, no matter your age. And so let's talk about, you know, I guess all adult men should be getting these tests.
Yeah, so Jenny, I'm a heart attack and stroke prevention specialist, so I highly recommend going above the standard of care. So all adult men, I think, should have a blood pressure screen, they should have a diabetes screen, an obesity screen, as well as depression, and a vitamin D check. Every year, go see your doctor and do those things.
Why is the vitamin D check again so important?
I feel like everyone's low. When I test people anecdotally, it's all below 30. We want it to be above 30, actually around 50 for optimal vitamin D. And it decreases risk for hypertension, decreases risk for cancer, just increases a lot of body systems and optimizes body function when your vitamin D is optimized.
Why are we all so low?
You know, we definitely should use sunscreen when out in the sun, but I think more people are inside now. You work all day, you don't get enough sun. A lot of foods are vitamin D deficient, so we're not getting the nutrients that we used to 40, 50 years ago. So I think that's one of the reasons why vitamin D can be a little bit low in most people.
What do you have to say to the guy who is sitting at home saying, I don't need to listen to any of this because I'm healthy?
You know, that's a huge misconception. You don't know what you don't know. And as a preventative heart attack and stroke physician, we found that most people that come into our office are not as healthy as they think they are.
Let's talk about the advanced screenings really quickly, these really specific ones.
And that's a great segue, because you don't know what you don't know. So when it comes to advanced screening, I love the CIMT, the Carotid Intima Media Thickening Test. It's a 10-minute test we do in our office. We scan both carotid arteries, the largest vessels in your neck. We're looking for thickening, so we can actually determine arterial age. So if you are 40 years old on the outside, I want you to be 40 years old on the inside, and most people are much older on the inside than they are on the outside. So it's a great test. We look for cholesterol plaque. We can also do a fasting insulin test, which most doctors don't do, and that is a pre-diabetic screen. So when you are fasting, when you haven't eaten anything for 8 hours, you shouldn't have any insulin floating around the bloodstream. You shouldn't have much glucose, no insulin, and that means if your insulin is greater than 10, you could have pre-diabetes. So it's a great screen for diabetes. And then my last one, electron beam tomography scan, is an advanced imaging scan. It's 90% less radiation than the CT scan, about 7 millirads, about the same exposure as a transatlantic flight. And it's a 3D imaging test. So we scan from neck to pelvis. I found thyroid cancer in a 31-year-old male that was asymptomatic, kidney cancer. It's a heart test, so we get a 3D image of the heart, lungs, kidneys, GI tract, a calcium coronary score. It's an amazing test that really goes above and beyond the standard of care.
I hope my husband's listening. Thank you, Dr. James. Appreciate you. We'll be back right after this.